My experience using the VR headset has been pretty immersive and engaging one. Wearing the headset and having those controllers, you're able to move your own self around in the room as if you were actually there. And it kind of helps you feel like you're taking care of a real patient. And so I think that overall it's helping prepare me for the real world challenges that I'll face as a PA. As a rural honor scholar, I've been given the privilege to be able to do one of my rotations in a rural area. And I think that using this VR headset will be able to kind of better prepare me for those, any different kind of patient interaction that you can expect. And I think that overall, as VR kind of progresses and advances, we'll be able to maybe apply it to give more patients in rural areas access to that healthcare, and also better train physicians and other providers to pretty much be ready for anything and be able to use what you have to your advantage so that you can give the patient the best possible care.